Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV.
Mountain Moving Faith. This is my latest book. And if you want to learn how you can move mountains, life has many mountains. While this journey, you will encounter mountains and you wonder, how can I move mountains? This is a book to read. And it took me time to research, to pray, and to wait on God and look at the scriptures and what Jesus talked about moving mountains. And this book is quite a story, it's quite an inspiration. It is quite something that will change your life. So order your copy today. We can send it to you wherever you are in this country. We will be able to send this book to you on Mountain Moving Faith. Call that number or send a message and our team will be able to ship it to you wherever you are. There's a book to read. You can also buy for your friend, for a family as a gift. And I have no doubt they will thank you and they will be always thankful for what you have done for them. So God bless you as you read this book, Mountain Moving Faith.
Infections in pregnancy contribute to nearly 15% of maternal deaths in sub-Saharan Africa. That is according to the World Health Organization in the year 2023. Pregnancy should not be a time to fear. It should be a time to rejoice and have the beauty of bearing a child. Now, understanding how to deal with infections in pregnancy is the key to living a healthy life and a healthy journey in your pregnancy walk. Greetings and welcome to the Healthy You. This is your favorite health program on Faith Today television. My name is Enock Kitondekijja. I am your host today. Permit me begin by acknowledging Jacqueline Hospital. Now, these are our distinguished partners. You can find them in Roysambu along Lumumba Drive, just opposite Park University. They are also in Mariaini and Juja Farm. Recently, we began a talk on infection prevention, and today we want to tackle infections in pregnancy. And to help us unpack this is no other person but a medical doctor from our partners, that is Jacqueline Hospital. But before I invite her, I am aware we have those of you who are following us on social media, that is YouTube and Facebook. We celebrate you and we want to remind you to subscribe. Please like this conversation. You could as well share with as many people as you could. And for those of you who are live on Pang, there's a number on your screen. Use it to send in your questions. The earlier you do, the better. Thank you so much. Back to my guests, Dr. Jacqueline. I know you have been here before, but for the sake of our viewers who are just joining us, they would love to know who you are. Yes. Kindly introduce yourself.
Hi, I'm Dr. Jacqueline Wangechi, a medical officer from JCK Hospital, and I'm honored to be here this morning once again to talk about infections in pregnancy.
Wow, welcome. Once again, this is Dr. Jacqueline for you, and those of you who have had a taste of the content she delivers on our platform, you don't want to miss this one, because this is Faith Today television for you. As we start, Daktari, how has been your week like?
My week has been good.
Yeah.
It's been busy, but thank God, so far so good. The year has started well.
Okay.
Yeah.
Wow. JCK Hospital, how is it over there?
Our JCK Hospital is doing very well.
Okay.
Our maternity department has been very vibrant, and we are very passionate about mothers and babies. So we've been very vibrant in our departments and, in giving quality care to our patients. Yes.
Talking of quality care, and I think that is why we have you today on the spot to help us understand these common infections in pregnancy, and also how do they impact both the mother and the baby.
Yes.
Yes.
So there are different types of infections in pregnancy. The infections caused by bacteria, like group B, streptococcus, chlamydia, gonorrhea, syphilis. We have viral infections like HIV, even things like chickenpox, measles you can get during pregnancy. We have herpes, cytomegalovirus, parvovirus B19. There are so many. We also have fungal infections like candidiasis. Yes, and yeah, those are the ones that I can think of right now.
Wow, there are quite many.
Yeah. Oh yeah, I forgot, sorry. Also parasites. Of course, malaria is also something to consider, yeah.
Okay. I think that is really a wide range, and you could tell why over like 15%, the report says like 1 or 2 in 10 women die, while giving birth because of these infections.
Yes.
So for a start, help us understand what are these most common infections that probably the mothers out there should be aware of.
Okay.
Yeah.
So in our setup in Kenya, the most common, of course, HIV is leading. And with HIV, things like TB and meningitis can be there. Urinary tract infection, that is common for almost every pregnant woman.
Yeah.
Yeah, those are the most common that are really affecting our women in pregnancy.
Yeah.
The rest, like syphilis, gonorrhea, of course, are also there.
Okay.
Yeah, and so it usually depends on how the patient presents and a lot of factors that we have to consider.
Yeah.
Yes.
And of course, speaking of UTIs, we've had very many women, they know it. It's now a cliche that whenever I feel unwell, it should be a UTI. Why is that so?
Yeah, so a UTI, you know, there are people who don't know what UTI is. Yeah. It's a urinary tract infection, basically. The infection can either be just in your so these sections of the urinary tract system can be just in the where you pass urine, the urethra. Yeah. It can go up to the bladder, it can go up to the kidney. So the higher it goes, the worse it becomes. And UTI in pregnancy is common. And why it's common is because, first of all, in pregnancy, your immunity goes down. That's why pregnant women are one of the special groups when we consider health. The other reason is because there's a hormone called progesterone that is produced on a higher level during pregnancy. And this causes the bladder to relax, the bladder muscles. So if the bladder muscles relax, then of course you're not passing urine the way a normal person would. And that means the urine stays in the bladder for longer, which is called stasis. And when the urine stays there for long, then the bacteria have time to really multiply. Yeah, and then another reason why pregnant women have high infections, there's usually some level of glucose in the urine, because in pregnancy, blood supply increases to all organs. So even the kidneys, the blood supply has increased. So the filtration is faster of what now we call urine from the blood and all that. Yeah. So glucose also passes through. And bacteria love glucose. So they feed on it and multiply. Yeah. And then of course, as your uterus is becoming bigger, it's putting pressure on organs in the abdomen. So that also includes the bladder. It sits on the bladder. So when it sits on the bladder, the process of now the urine passing from the bladder out is also affected because of that pressure. That's why UTIs are very common in pregnancy. So like women who have diabetes, women who've given birth many times, because giving birth many times, there are changes that happen to your body. Your pelvic muscles, they relax, they're not as, what can I say? Yeah, they become more relaxed, not like somebody who's not given birth. And then, of course, your system has had, pregnancy is a whole process and all those changes. So that increases your risk. And of course, hygiene. Hygiene is number one. For all these infections, hygiene is a big factor, especially for the bacterial. Yeah, so hygiene also affects why you would have recurrent UTIs. And of course, if you've ever had UTIs before, then your risk of getting it again is higher.
Why is that so? Like, someone has had it before, why are the risks higher?
The risks are higher because you're already exposed.
Yeah.
So sometimes you find maybe the infection didn't clear completely.
Okay.
Yeah, and then there's those inflammatory processes that have happened in your body.
Yeah.
So you are at risk of getting it over and over again.
Yeah.
Yeah.
And I think that is very important to note, having ironed out this one UTI, urinary tract infections, something important that we should really be aware of, because according to the African Journal of Reproductive Health in 2022, we learned that infections like UTI and bacterial vaginosis are responsible for 30% of preterm births. That is Africa. And I think that is why this conversation is very important. Those of you who are just joining us, this is Faith Today Television, and we are discussing infections and how do we deal with them in pregnancy. Needless to say, the do's, the don'ts, and we have a doctor on set today to help us understand this. If you have any question, use that number on your screen and we'll be right here at your service. Now, speaking about this, you've talked about them affecting now the mothers, you know, so we would want to know also, the babies, how are they involved in this equation and how are they exposed to these infections?
Okay.
Yeah.
So let me tie it up with not just the UTIs but other infections. So first of all, for like the viral infections, of course, sexual partners will affect that, like even HIV. And then also hygiene, because sometimes having close body contact with people, you can easily pass, you know, through sweat, through secretions, you know, things like chicken pox you get through secretions. When you look at that whole process of infection, okay, please repeat the question. Sorry, I've lost the plot. Yes.
Thank you so much. I know you, those of you who are just following us, it is a deep discussion. All we want to understand today is, doctor, to help us now narrow down to the infections that impact the children. I know you've talked so much content about the, you know, the mothers, how they are affected, but now we want to concentrate, help us narrow down this to the babies.
Yeah, sorry. Yeah, so when you get this infection in your body, first of all, your body responds. There's an inflammatory response. So then there's an attack can be mounted on your baby through your response to the infection. The other reason is the infection can pass through the placenta to the baby. So now even the baby is infected by the condition that you're having. So this now comes up in terms of the development of the brain can be affected, development of the heart, even the muscles, the bones. So the infection now goes in and the baby starts having effects. And you see a baby who is growing in the uterus, first of all, like the first trimester, which is week 1 to 13, is where now major formation of the baby is happening, where all those organs are now being formed from scratch.
Yeah.
If you have an infection, especially during the first trimester and even the beginning of the second trimester, then the process of development will be affected greatly. Yeah. If a baby's development is affected, then of course this child won't be normal. And for some, even surviving becomes impossible. Yeah, that's why I think it's very important to be aware about infections, because you can actually lose your baby, or your baby can grow up with disabilities or retardation and all that. So it's the effects are so wide. Yeah. So even just something simple like a UTI, by the time it gets to your kidneys, you have the infection is actually in your bloodstream. It's not even just in your urine anymore. Yeah. This is going to your child. The effects will be big.
Wow.
Yeah.
That's quite interesting, because when you really now help us understand the process of how these infections get from the mother, then to the babies, and then to make it serious, even their brains are really exposed. That is something that someone should not take lightly. Yes. Yeah. And then speaking of that, infections in babies, like, you know, preterm, we've seen mothers who have been giving birth to children before their time and the dead. What are some of these risk factors, or what should a mother look out for, that if I see this, then I should take this serious?
Yes. So if you're feeling like you have a fever,
Yeah.
you're feeling your body is just sick, you're just feeling you're weak, or you're not okay. In the case of UTIs, if you're feeling pain when you're going to the short call, you feel like whenever you go to the toilet for a short call, you feel like it's not fully all coming out. If you're having discharge, of course you shouldn't be having discharge. If you find that you're leaking, there's fluid coming out of your genitals, and you don't assume it's urine. It could be your water has broken because of an infection. If you're having abdominal pain, don't assume it's because maybe the baby has sat in a particular position and that's why you're feeling the pain. It could be an infection. So it's good not to ignore those signs.
Yeah.
It's good to just have a checkup and be sure.
That's very important. And for the mothers who are following this discussion, it's important for you not to take any sign, any something that is unusual lightly, because it can either affect your baby's brain development. It can also, prevent them from really getting the entire time they are supposed to be in your uterus, so that you do not have these preterms like we have talked about. Now, moving forward, we will also want to understand, Daktari, you talked about hygiene as one of the practices that could predispose people to some of these infections. Are there other forms of practices or risk factors that mothers should not overlook?
Yes.
Yeah.
Let me first talk about hygiene, because hygiene is a big issue.
Yeah.
There are small practices we don't think of that are very important. Something simple like washing your hands before going to the toilet. We always talk about after.
Washing hands before
yes.
going to the toilet.
Yes.
I thought it should be after.
It should be both.
It should be both?
Yes.
Now that is something I didn't know.
Especially for women.
Okay.
It's both.
Perfect.
Yes.
Carry on.
Yes, so things like that, things like hydrating so that you clear your system quickly. If possible, somebody should use a shower instead of a basin, because a basin, as you pouring that water on yourself, some of it will go back to the basin. So as you're removing your dirt from a body, if you're washing your genital region, you're gonna make yourself sick. But at least for a shower, the water is going down, so there's no that water coming back.
Okay.
Things like not eating raw food.
Before you go into the food,
yes.
I'm loving the way you are now breaking it down. For us in the city, there are people who can afford rooms that have a shower.
Yes.
But for a mother who is in deep down there in, let me say, Muranga, or let's say in Masaka in Uganda,
yes.
they can't access that shower.
True.
What would you advise them to do?
So for them, if possible, should separate washing of the genital region from just the general body cleaning.
Yeah.
Because now if you usually start from head going downwards. So this water, as you pour and some of it is coming back and then you wash your genital region with it, that will be a problem.
Yeah.
So if you can separate the two, that would be really good. And actually something I almost forgot, if possible, use liquid soap.
Liquid soap?
Because bar soap, bacteria will be left there.
Okay, on the soap.
Yes, and then they'll continue multiplying.
Yeah.
So every time you're using it, you're just reintroducing bacteria to yourself.
Yeah.
So liquid soap is better because there's no that contact over and over again. And of course, in our setup, most of us are in a family setup, especially for pregnant women.
Yeah.
So this soap you're not even using alone.
Yeah.
So liquid soap will be better.
Okay.
Yes.
I think that's interesting. We now know that for mothers, if you are showering, if you are taking a bath, you don't do the ordinary way. If you can afford a simple jerry can, you can use that. Make sure you do not reuse the water just to help you go through this entire process. We also learn that the kind of detergent that you're using, it should be the liquid soap, not the bar soap.
Yeah. And even a small obvious thing. Yeah. I know we are told for women you should wipe front to back.
Yeah.
The women you find have never actually had such a thing.
Yeah.
So please let me emphasize, women wipe front to back, not back to front.
Not back to front. I think that is a very serious subject that I know you're going to help us understand in the second part of our discussion, because is this a part of the package of the pregnancy fair you guys are having?
Yes, definitely.
Wow. And I would love to engage with you on that. And then before we go into now the practicality, you're still ironing out certain things that mothers should do. You've talked about hygiene,
Yes.
bathing, and then you are to talk about now the food.
Yes.
Yes.
So avoid raw food at all costs. Raw food, like in our Kenyan setting, and even Africa in general, you can't really say the quality of the meat you're taking. It could have parasites in it. It could have anything in it. You know, things like typhoid you can get very easily from these foods you're eating. So it's good to make sure your food is well cooked, properly cooked. If you're eating seafood, well, it's controversial in pregnancy about seafood, but if you really must eat it.
What do you mean by seafood?
So seafood is fish, shrimps, prawns, shellfish. In pregnancy, you're not advised to take a lot of seafood. You can take your fish, but make it properly cooked. It should be well cooked. Milk, make sure your milk is well boiled. You're buying from a supplier that is verified, pasteurized milk.
Yeah.
Otherwise, the things like brucellosis you can pick up from the milk. Yeah, so basically, and then also making hygiene in preparing food, making sure your hands are washed. You know, everything that you're doing in the kitchen is hygienic.
Yeah.
That will save you from a lot of trouble.
Okay.
Yeah.
Oh, thank you so much. This is your favorite show, the Healthy You program on Faith Day Television. We are breaking it down for you. What should you do when you are pregnant? Are you expecting? Are you planning to have a baby? This is the information that you need. And if you would share this conversation with as many people as you can, your sister, your auntie, your mother, probably you will help them live a healthy life so that we can reduce on the mortality rate of mothers in sub-Saharan Africa. Speaking of that, Dr. Ali, I want us to engage gears now to talk about, you know, this is Africa. There are so many myths. I need you to help us iron out. Do you know any myths? I mean, you're in the practice out there. There are some people who say you're not supposed to take this drug. Some people are like, I've taken it. You know, the antibiotics. The other day we were talking about how antibiotics are no longer working. You know, so I know you have some of those myths. You can help us understand these myths and how do you debunk them?
Yes.
Yeah.
Well, for medications, definitely there are medications you shouldn't take in pregnancy.
Yeah.
And there are some you'll be told don't take in the first trimester. Like I said, first trimester is where the major development happens. So it is avoid taking medications without a doctor's prescription in pregnancy. Even in breastfeeding.
Double click on that. Kindly double click on that. Avoid?
Avoid taking medications without prescription in pregnancy and breastfeeding.
Perfect.
Yes. You can cause your child abnormalities that they would not have had in the first place if you did that. It's going to cost you. So please do not. Even pain medications, first consult. Don't just take any medication. Yeah.
Okay.
And then, so the other myths and misconceptions we have, well, most of these infections in pregnancy can cause you to miscarry, can cause you to give birth. The child we call a macerated stillbirth. That's a child where the infection got so bad, the child actually died in the uterus and even started having changes of death. So by the time they're coming out, it's just a very horrible sight to see.
Yeah.
Yeah, so it's important to make sure that you don't assume. I know that Africans, we have this, somebody looked at you badly, or so-and-so has put witchcraft on you.
Yeah.
So you're wondering, why am I always losing my pregnancies? I know there are many causes of pregnancy loss. You know, like there can be trauma, you could be having fibroids, you know, maybe the placenta was not the right position. There's all those reasons. But sometimes there are people who get recurrent pregnancy loss because of infections. And so because you didn't get diagnosed, you weren't treated, so then you keep losing pregnancies and you're wondering why. So let's keep witchcraft and such ideas out of it. Yeah. Let's get the proper test done. I know we'll talk about ANC test, but yes, get the proper test done. Don't ignore any symptoms you're feeling. Another misconception, not a myth, is what we had actually talked before. You could actually be leaking your amniotic fluid, and you're assuming you're having incontinence of urine. Because at the beginning it will be clear fluid, you may not even have any smell. But the problem is that means your cervix is open to a certain extent, and the membranes there's a bit of rupturing of the membranes, and that's where the fluid is draining. Yeah. Once that happens, any infection, whether UTI or even just a hygienic issue that can introduce an infection to your system. So the infection will go up all the way into the uterus. Yeah. Then now when the infection goes inside the uterus and the child gets sick, the amniotic sac is infected, you can lose your pregnancy. Yeah. So let's not assume that water you see and it's just urine, actually get it checked to confirm, because if it's not urine and you're actually having premature rupture of membranes, it's very serious. Because also in terms of just having a simple infection, if it's not treated on time, the infection will progress until you get to a point called sepsis. Sepsis is a life-threatening condition. Sepsis is when the infection has entered your system and now it has made changes to your system such that now you're starting to have organ failure. So you can imagine having organ failure from a simple infection that could have been treated. You can die yourself, not just the baby. So those are things we shouldn't ignore, or it's good to be informed on such things.
And I like the way you assert it, that someone can really lose their lives if they take these infections lightly. Let us switch gears. I know we are going to take a break, and those of you who are just joining us, there is so much that we are diverging today concerning infections and pregnancy, and we have one Dr. Jacqueline Wangechi from JCK Hospital. Mark that, from JCK Hospital, and is helping us deal with all this. And Dr. Ali, walk us through the process of diagnosis. How do you come to, we've seen there a number of infections. How do you get to the diagnosis?
So for the viral infections, unfortunately the diagnostic tests for them are expensive, because we are looking at DNA, things called PCR tests. Those are expensive, so for some of them we do more of clinical diagnosis, the symptoms you came with, the history you'll give me. For some simple things like UTI, you can do urinalysis. That one is a very simple test, and it's something that should be done at least once in the first trimester and once in that trimester. So we do a simple urinalysis. And actually, to note, for UTI, not everybody has symptoms. There are people who are asymptomatic. They come without any symptoms, but they actually have a UTI.
Double click on that.
Yes. So that's why we have routine urinalysis tests for pregnant women, because it's not all the time it has symptoms. By the time it's having symptoms, it's serious. It
is serious.
Yes.
So doctor is here giving us some great tips for your health. Very important. For UTI, sometimes they will not show any symptoms. So any sign, whatever you feel unusual, it's important that they come to you guys, and then you take them through the investigations and then diagnosis. Carry on.
So you can do a urinalysis. If you're having recurrent infections, or it's a very serious infection where you are seeing you're really sick, we can do something called a urine culture, where they take the urine sample and grow it on a dish, and they're able to see exactly what bacteria you're having and what antibiotics are responsive to it. By the time the infection, like in a UTI, is getting to the kidneys, even a simple blood test, a full hemogram or complete blood count will show us infection even in your blood. So then by the time the infection in your blood, we know it's serious. So those are the mainstays, especially for UTI. For the other tests, there are like syphilis, there's something called a VDRL test. Of course, HIV, there's a HIV test. So there are those also specific tests for all those other diseases.
And you do this at JCK Hospital?
Yes, we do them.
Okay.
Yes.
Wow, and that is quite interesting. And I know there's someone who is really curious to know about now, in case there are no symptoms, like what should someone do? They don't have any symptoms. Now you've talked about a possibility of having a UTI in there. Like, I think that is when we will talk about the ANC, right?
Yes.
Yes. For those of you who are just joining us, this is the Healthy You program on Faith Today television. It's brought to you by JCK Hospital. You can find them in Roysambu, along Lumumba Drive, just opposite Park University. And those of you who are in Mariaini, make sure you do not miss them. They're also in Georgia Farm, just right here at your service. So we learned that it's important. There is a wide range of tests or investigations that these people will do for you, so that you can understand what you are dealing with, and they're able to even offer the necessary treatment that you need. We have also learned that different means, it's important to understand the facts and not mess your life around. Otherwise, you deserve to live better. We are going to take a short break, and when we return, we are going to understand the role of these health professionals in supporting you, in supporting the pregnant women out there. We also want to understand about the pregnancy fair. They're having this pregnancy fair. It has been happening for a long long time, and this is going to be the first of its kind in this year. They have really hyped it so much, so today we want to break it down and understand what are they really offering and why are they doing the pregnancy fair. So you don't have to go anywhere, just keep it Faith Today Television.
Okay, asante. Nilikisajili kitabu ambacho kinaitwa 7 Keys to Success, ama kuna kanuni funguo 7 if you like it, ambazo zitakuletea ushindi na kufaulu maishani. Wote, wewe na mimi, tunataka kufaulu, lakini pia kuna njia ya kufaulu. Ukisoma hiki kitabu ambacho nilikiandika kwa kufanya utafiti, kwa maombi mengi, kuangalia neno la Mungu, I have no doubt ya kwamba hiki kitabu kitabadilisha maisha yako. Nilikuwa naongea na mchungaji rafiki yangu, akaniambia nilisoma hicho kitabu, sasa ninafundisha watu wangu kupitia ujuzi, maarifa, hekima ambayo nilipata kwa hiki kitabu. Kwa hivyo unaweza pia nunulia watu wengine, na akaniambia alinunulia hata viongozi wake, na wamekuwa wakisoma, wakaweka kwa library yao wanasoma. Hiki kitabu sina mashaka, nina uhakika itabadilisha maisha yako na utabarikiwa. Tuma message ama upige simu kwa hiyo namba, na naweza kuwasiliana na wewe na utapata hiki kitabu, utatumiwa, usome na ubariki pia watu wengine. Asante. Mungu akubariki unaposoma 7 Keys to Success, and you will succeed. Thank you.
Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV.
Yes, welcome back once again to our discussion of infections and pregnancy. We have a distinguished guest today who is coming from JCK Hospital to help us understand the do's, the don'ts, and get all the myths debunked right here, right now on Faith Today Television. This is the Healthy You program. And those of you who are just joining us, we are in our second part of our discussion. If you've not yet sent in your question, please do so right now. I see people sending in their questions, and we want to appreciate you for tuning in. As you do, kindly also help us understand where you are watching from, and if you would give us your first name so that we can be able to address you directly. Thank you so much. Before we really get into the second part, really, I want to do justice to our viewers who have sent in their question first. You know, we say first come, first serve. Thank you. I have, I'm Juliet. This is Juliet. Juliet is asking, can these infections affect intimacy? Does that mean my partner should go for a checkup too? Thanks. Daktari will be answering that question. And can you take it now?
Yes, you can
All
go
right.
through them one by one.
So,
So definitely it will affect intimacy, because first of all, there's inflammation in your system. You will not enjoy intimacy at that point. You'll probably be having a discharge in some cases, very bad smell, and even abdominal pain. So definitely it will affect intimacy. And your partner must be tested and treated also if they are having an infection. So both of you should be on medication depending on the infection that you're having. Yeah.
Perfect. And then I have one saying, morning. All right. This is, I didn't get her name or his name. Morning, following closely, can a yeast infection harm my pregnancy?
A yeast infection can, because it will continue growing if it's not treated. So then it will continue growing up your vaginal tract, get to the cervix, start causing irritation. You can go into preterm labor. And then, of course, preterm labor, if a child is born when they are premature, then there will be trouble, because a premature baby, first of all, the immunity is not good. Depending on how premature they are, even development levels can decide if they will survive outside the uterus or not. So there's that risk. So candidiasis should be treated. And also when you're giving birth, if you do a vaginal delivery, that child will get candidiasis. So the next thing you start seeing them having skin rashes that are fungal type of skin rashes. Yeah. So it should definitely be treated.
Perfect. And then we're having another one coming in from, you didn't give us your name, but I pray you do next time and let us know where you're watching from so we can give you the best approach and assistance. This one is saying, please doctor, help me understand how being infected can cause preterm labor. Oh, this is Mary from Thika. Thank you. This is Mary from Thika saying, please doctor, help me understand how being infected can cause preterm labor.
Okay. So when you're infected, so also once again depends on which type of infection. So the infections that cause either your body to be really sick, like you just have a systemic infection, infections that cause you to go into sepsis, what I told you, a life-threatening condition where your organs start to fail, infections like pneumonia, which can go to your lungs and affect oxygen for you as a mother. If your oxygen supply is affected, then of course the oxygen supply of your baby is affected. So then the child will have even brain damage. Infections like the one I said that go up your system, up inside the uterus, causing inflammation of the uterine walls, causing infection of the amniotic sac, causing infection of the placenta, causing infection of the baby, definitely will affect pregnancy. First of all, development will be affected. The child will also get sick, so that also affects the development. And then even your body is compromised. So even the ability to hold a pregnancy becomes compromised. So you can easily go into preterm labor, or even your membranes can just rupture, because even the quality of the amniotic sac is affected. Once your membranes rupture and the fluid starts coming out, there's usually not a lot you can do, especially if you've lost a lot of fluid. There treatment and even delivery. And actually, something called chorioamnionitis, which is inflammation of the amniotic sac and the amniotic fluid in the baby. That pregnancy, you can't keep it anymore. We have to deliver the baby immediately. Whether it's a viable pregnancy or not, that baby has to come out for the sake of your life. So yes, depending on the type of infection, then there are drastic measures that have to be taken.
Wow.
Yeah.
And I love the way you assertively state all the measures that mothers should take. Because when you talk about all the, the I won't call it the jargons, but the terms, it's basically the internal environment that protects the baby. It gets infected by these infections. It will not only end on that environment, but also the entire body. You, the one who's hosting this, this baby. And that is very important. Those of you who are just following us, doctor is doing justice to every question that you're having concerning infections in pregnancy. If you have that question, send it in. Let us know where you are watching from, so we can give you the best advice today. Yes, and Dr. questions are coming in, and I'm sure people are really enjoying this discussion. I want us to now shift gears to understand the role of antenatal care in preventing and managing infections.
Okay. Yep. So I cannot overemphasize the importance of the antenatal care. It's very important, and it's a holistic care. Because ANC, when you first come for the first visit, it's good to do, there's those tests. There's a routine test that after research by the government, WHO, all those things, there are tests that are standard for every woman that ensures the safety in pregnancy. Some of the tests include HIV, syphilis, hepatitis B, urinalysis, just checking your full blood count, even checking your HB levels. If they're low, we need to raise them up. So tests like that, and of course even an ultrasound. An early ultrasound is important because in case there are any problems, they can be picked up early and acted on accordingly. Yeah, so those are the tests that are very important in ANC. And also ANC also is a place where mothers get education about pregnancy. You know, you'll be told to hydrate, you'll be told which supplements are important to help in the development of your child. Things like having a folic acid deficiency in pregnancy will affect how the brain and the nervous system of your child is developing. So some of that information, knowing the danger signs in pregnancy, like if you have a fever, if you're in severe pain, if you lose consciousness, you get a convulsion, if you're bleeding, you need to rush to hospital. We think some of those things are obvious, but they are not. So ANC is a place to learn, a place to diagnose things early, prevent. We talked about the urinalysis. It is routine nowadays that urinalysis is done in the first trimester and in the third trimester. So that helps also cover the asymptomatic the UTIs, because we're able to pick them up. ANC also, like, you get your examinations, we listen to the fetal heart rate, you're educated, like, once the child starts moving, how many times should the child play in a day, you know, being able to know that, hey, if you don't hear within a certain number of hours my child is not playing, I need to get checked. So some of that information is important. I know from our different cultures we have all these myths and misconceptions that your grandmother told you or your mother that are not correct. So ANC is a time to learn, both during pregnancy and even after pregnancy. It offers also the support that you need. And also during ANC we get a vaccine called the tetanus toxoid vaccine. During your first pregnancy you should get 2 shots. The first shot is as early as possible, even in the first trimester. On the first point of contact or even the second clinic, you can get your first shot. After 4 weeks, you get your second shot. Any other pregnancy after that, up to like 3 more pregnancies after that, you'll get 1 shot of tetanus. That is important. For some of the diseases we've discussed, and I know there are so many we can't discuss all of them, some of them have vaccines, things like measles, mumps, rubella. There are those that have been pneumococcal, flu vaccine. But then there is always a concern of, is it safe to get? Some of these, like the measles, mumps, rubella are live vaccines. You cannot be given during pregnancy. You should actually get them at least a month before you decide to get pregnant. Things like flu vaccines, pneumococcal vaccines are important. But now, in Kenya, we've not yet made that a normalized thing. And then I know also a lot of people get pregnant without proper planning. Yeah. So even saying that you'll get a vaccine 1 month before you get pregnant, I know for a lot of people that is not practical. But I hope that as we develop as a country, we will get into that level of vaccines. But as for now, the tetanus vaccine is a standard vaccine for pregnancies. Yeah, so I think
that's quite a great lump of information.
Yeah.
And I believe it's really very vital at this point, because now it helps us to really emphasize the importance of now ANC, because some people may take it lightly, or because people are really busy, and you've tried to help us understand that some of the things that you get when you do attend to these ANCs is the information. It's very important, and you've always had us stress that information is powerful. Knowledge is very key, so don't miss out on this information. Every detail could save your baby and could really contribute to your safety, so you can enjoy your journey throughout a pregnancy. We've also learned that there are standard tests that they're gonna do to help you know your stand, and also iron out any kind of infection that would probably harm or endanger your baby. So it's very, very important. So speaking of the ANC, do you people offer this at JCK Hospital, and how do you really take us through this ANC at JCK Hospital?
Yes. So for JCK Hospital, we take our mothers very seriously. We love pregnant women. We love babies. That is part of the work we do, and we love it. So for the ANC, we have a very good team there. They really follow up the mothers, following up to make sure you come for your monthly checkups in case they pick up something, because mostly ANC is run by nurses, midwives. In case they pick up any small issue, the doctor is always involved immediately. And once you pay for ANC, we won't charge yourself for the doctor. We'll just, it's a holistic care. So we make sure we address any issue that comes up. There's so many times I've had women come for ANC, and they're saying they're having just back pain. And so they come to see the doctor. And on urinalysis, it's a UTI, you're not in labor. So there's always that partnership between the ANC team and the doctors to make sure that there's holistic care for the mother. Making sure like you get to listen to your fetal heart rate. If you want to know the gender of your baby, you'll be advised at how many weeks. Making sure you get your right injections. Making sure you're well educated on the danger signs. You know, if you're a mother who's given birth via CS previously, just that follow up to make sure that you deliver the right time. So us as the doctors, we are always available, even on phone. There are people who call me at night and they're like, hey doc, I'm actually going into labor and they're a CS mother, and you know, we'll rush and take you to theater and everything. So we make sure that the mothers are well taken care of. Any disease that is picked up is treated on time. Things like HIV, we make sure you get treatment as early as possible, because we also have to reduce transmission to the baby, and also just walk in that journey with you in case maybe, you know, there are so many, okay, not so many, but there are women who get to know they have HIV during the ANC period. They didn't know. And it's usually a very devastating position to be in. But we try to work with the mother and encourage that mother, you know, and just counseling and make sure that they're able to take care of themselves so they can take care of their babies. Yeah, so just making sure mothers are well educated, everything is fine. Whenever there's a gynae needed to review the patient, we always make them available. So we also have gynae clinics at our facility, Monday and Tuesday mornings, but it's you have to book. It's not a walk-in. So yes, I'm sure you'll put our hospital number. So if you need to make a booking with the gynecologist, it's important. If you have a history of pregnancy loss or diseases in pregnancy, even just not infections, even like diabetes and hypertension, the rest, it's very important. I cannot emphasize, very important to work with a gynae, because you see, a gynae has furthered more into that kind of care. So we have a team of gynaes available. Yeah, so you just book. But in case of emergency situations, we avail ourselves. We make sure the mother is well taken care of.
What do you mean by emergency situations?
So emergency situations is like a mother who has gone into preterm labor. A mother maybe where the child is not playing, so you need to figure out what's going on. A mother who has serious infections, and of course other issues in pregnancy, like, you know, the high blood pressures that are really high, or diabetes that had not been diagnosed, and all that. Those are situations we take seriously. Or even a mother who previously gave birth via CS who has gone into labor, that is an emergency situation. Yeah, so things like that.
Oh, that's quite interesting, and you helping us understand that you have the capacity to deal with emergencies. I think that is something that my viewer would want to hear from you. And I see like you have a predetermined program and you're really smart at what you're doing, but we also want to understand, as you people who are doing the services to our mothers and people out there, are there challenges that you meet while offering this care to the mothers? What are some of the challenges?
So some of the challenges we face is somebody coming to NC when the pregnancy has really progressed. And so we are picking up some things late, even sometimes during actual labor. Then you're picking up you have HIV. You've never taken meds for HIV. Your child is at risk. So there are times like that. Somebody has an infection, let's say like HPV, has very big genital warts, or you have herpes, so you have lesions in your genital region, which means you can't push, because once that baby passes there, you're going to infect that child. So there are situations like that of either patient not having proper knowledge. Also the one I was telling you, where you've been passing fluid, you think it's urine, and you actually passing liquor, and then you come to the hospital 3 days later and things are really serious. Then we're here running to make sure you don't get sepsis, you don't lose your baby, and we're trying our best. So those are some of the challenges. Another challenge I think I've seen is I think it's lack of knowledge, because depending on the country you're in, pregnancy is viable different weeks. In a very developed country where they have proper like health systems and proper machinery and all that, pregnancy, if you give birth at 20-24 weeks, there's a chance of survival. In our setup, that is not going to happen. Here, at least 28 weeks. Let's say 26, 28, but mostly 28 weeks. And even then, if you're going to labor and you know it's that early, you need to go to somewhere with an ICU, a neonatal ICU. Don't go to just any hospital. Unfortunately, JSK, we are not yet at that level. You need to go somewhere like Kenyatta, Mbagathi. Those level 6 hospitals. We are at level
do
4.
with neonatal ICU. That
Yes.
is newborn.
Yes, ICU.
Yeah.
Because that child, if they're not put on, machines to help keep them alive,
Yeah.
they will not survive. So those are some of the challenges we face. Yeah.
So in case you encounter a complication like that, when the baby, the rationale is to take them to, let's say, Kenyatta, let's say you've talked about those other facilities. Do you have the capacity to do that? And how do you
Yes.
go about it?
We have an ambulance. Our team is always ready, so we transfer you as soon as possible. Unfortunately, in Kenya, there's a referral system, and sometimes there are delays. So that is also another challenge, because the hospital has to accept to take you. That's why I'm here saying, if you know you're like less than that 4 weeks gestation, please just go to direct. If you go direct, there's no problem.
Yeah.
But once you go to the hospital, they have to refer you. It's usually quite a process. And for some of these women, by the time you come, the baby is literally coming out.
Yeah.
There's no chance for referral at that point. It's too late.
Yeah.
So it still comes back to listening to your body.
Yeah.
Really listen to your body. Don't ignore any small thing. Just get it checked. You'd rather come to hospital many times and we tell you you're fine than you ignore something small. And then by the time you're getting help, it's a bit too late for much to be done for you.
I think that's the punchline. You'd rather go to JCK hospital or any other hospital many times than not going at all, and you later find out that you did the wrong thing.
Yes.
So that's a very important point. And those of you who are just joining us, you can tell we are really offering a surgical approach to this discussion, because we don't want you to miss any information concerning pregnancy and how the hospitals that we have on ground are dealing with them, because we also learned that there are the challenges these people face, and whenever you come a bit late, you put them in a very difficult position. Your expectations are really high, but because of the emergency, there is nothing, not so much can be done. That's why we encourage you, get the information, subscribe to this channel. Whenever there is, you talked about something key. Before we wrap up, the pregnancy fair. What is the pregnancy fair, and what really are you offering in this package? What is it? Help us understand that.
Yeah, so we are planning a pregnancy fair for all the pregnant women, which will be this Saturday 15th at our hospital, JSK Hospital at Roysambo, Lumumba Drive, next to Park University. It is basically a day to have fun and to learn. So we will be having free antenatal consultation. We'll have a gynecologist available for any mother who needs to see a gynecologist. We'll have ultrasounds at half price, which is 1,000 shillings. We'll have a health talk where we get to teach you on different things to do with pregnancy. You can ask questions, we will answer. It's an interactive session. We will dance, we will eat, we will have a good time. And we also will have a gift hamper for every mother and a hospital tour, so that you also get to know us. You get to know what are we offering, how do our facilities look like. Yes, it's just a get to know each other session and an empowerment session and just a fun day for our women. Yeah.
Wow. I feel blessed to have you today on this show, and the information you have given to us. You have really touched some of the pressing issues we have today, because when you look at it in our setup, what is failing our population, Africa, is information. People do not get the chance to have such information, but we also want to appreciate JCK Hospital for making such programs possible. We also want to encourage you, our viewers, if you would share this link to as many people as you can. Let us reach out to the people with this information, because the missing link, like you follow this discussion, is information. Without the information, without the knowledge and the right people to help you with it, it may not be so much good news for you. But I want to appreciate you once again for joining this conversation. This is the Healthy You on Faith Today television, and don't change that dial. I will take just a few questions. If you are lucky and you sent your question with your name and where you're following from, I will pick you first. I have Fiona. Fiona says, my friend was telling me, if I'm pregnant, I can't swim in a public pool. Ni kweli?
I've not heard of that. Of course, back to hygiene. Don't go to a pool that you know it's not hygienic. If you're having an active infection, please do not go swimming. because you are compromised. Yeah, so swimming is allowed, but of course make sure it's a hygienic place and you're not currently having an infection. Yeah.
Wow, you get that.
And of course proper clean up afterwards to remove everything.
Okay.
Yeah.
Wow, people who swim like me and knowing that.
Of course, don't go swimming in the river.
So for the swimmers, don't get worried. The information is here for mothers who are swimming in that pool. They are advised by the doctor. Make sure you're not infected so you can infect other people. So make sure you go for that checkup before you do the swimming to help our swimmers. People, do you love swimming yourself?
Definitely. I swam during pregnancy.
Really?
Yeah.
Wow. I think that should be a discussion for another day. We are wrapping up, Dr. Ali. Just one parting shot, like for our viewers. Look into the camera and then give them that one parting shot. Scan this one.
Okay.
Yeah.
So, infection and pregnancy are a very serious issue. It can start as a very simple thing and end up fatal, both for you and your child. You can end up raising a child with abnormalities like cerebral palsy, a cardiac issue, brain issues like hydrocephalus, just because of an infection that could have been treated early, and prevention could have been done by avoiding practices that can put you at risk. So attend your clinics religiously. You know, when you're advised to do the tests, do them. Allow the healthcare professionals to guide you. Please, whenever you have like a myth or something, like now what Fiona has asked about swimming, it's okay to ask. Ask the doctor you meet, like come to JCK, ask those questions, we will answer you, we will guide you on how to take care of yourself. Those hygiene practices we've talked about, let's practice them, and don't ignore any small sign, get treated on time. Some of these infections, even your child after birth will have to have antibiotics or even antiviral medications. So you see, the effects can be quite big. So please, early detection, take care of yourself, early treatment. That is the best way to go with this. Yeah, thank you.
Wow, that is quite interesting. And of course, from Dr. Jacqueline from JCK Hospital. Thank you so much. That has been a very enlightening conversation. And for our viewers, as you have heard, a pregnancy is a journey, and you ought to take proper care of your health and your baby. Very, very important. Do not ignore these infections if you would. And of course, she has highlighted the pregnancy fair that is happening this very Saturday. Make sure you don't miss it. What we have discovered today is information deficit. There is a link, there is a missing link, which is information, and these people are ready to offer you and a wide range of other offers. Don't miss what they have to offer. And of course, those of you who follow us and you are in hospital, you are under any form of treatment, we believe that these doctors are an extension of God's healing hand. So we pray for a quicker recovery for you, and we trust that you get the best result out of whatever treatment they are offering to you. My name is Enock Kitondekijja, and this is the Healthy You on Faith Day Television. Until we meet next time, stay proactive, stay informed, and stay healthy. God bless you.